This is a coronavirus. There are in fact many different types. Some are mild, causing the common cold, others are deadly. Now there's a new strain. It's one that we've never encountered before and one that can kill. So little is known about this new virus. Scientists fear the number of deaths it causes could rise dramatically in the next few weeks.
I do think we should be concerned. This is a virus that we know nothing really about, and until we have that information and information around how is it transmitting to people, what is the severity range of the disease, it's going to remain concerning.
Officially called 2019 nCoV, it's not easy to detect, much like a cold or the flu. It's spread the same way, through coughing, sneezing or contact with an infected surface. Initial symptoms can be simply a headache, fever and a cough. It can progress to pneumonia, though, causing breathing problems and kidney failure. For people with weakened immune systems, it can be fatal. In 2002, a global health emergency was declared when the SARS virus spread rapidly across the world. It too originated in China and killed nearly 800 people. That pandemic led to changes which could help reduce the spread of this virus today.
China is now much better equipped to respond to this sort of threat than it was 20 years ago, but also movement, travel within China is much more than it was 20 years ago, and many more Chinese people travel overseas than did 20 years ago. So there are pluses and minuses in terms of the challenges of responding to a new epidemic.
Here, passengers arriving from Wuhan were not being screened but told to seek urgent medical advice if they start to feel ill. With an incubation period of 5 days, Public Health England insists thermal imaging won't detect every case of the virus.
From a public health point of view, early detection, isolation, so that you prevent transmission is always the key. That's how SARS was controlled back in 2003. There was no treatment, there was no vaccine. It was a straightforward public health measure, early detection, isolation, so that you prevent transmission and therefore you prevent spread.
Whether this becomes an international emergency will be determined by the World Health Organization, but with numbers of infection growing, it is perhaps inevitable.